Birth registration is the first step towards recognizing a child's inalienable right as a human being. In Nigeria, there are provisions in the current legislation indicating that registration shall be carried out free of charge within a period of 60 days from the date of birth. Despite this provision, birth registration rate over the years has been worrisome across the country. The implication, however, is that unregistered children are uncounted and unaccounted for as they are considered as non-existent in the eyes of the government or the law. They are without proof of identity, thereby excluded from accessing education, healthcare, and other vital services. They are also vulnerable to exploitation and abuses. In a bid to change the narrative, the Nigerian government, with support from key stakeholders, have embarked on a rigorous campaign that will see respective states key into the birth and death registration initiative. The gains of such campaigns may have started yielding the desired results in view of the 2021 Multiple Indicator Cluster Survey, MICS reports indicating a 57% increase in birth registration across the country. Analysis of the MICS report indicates that Lagos State recorded the highest number of birth registration with 94%, closely followed by the FCT with 87%, while states with lowest registration are Jigawa with 23.6% and Sokoto with 22.5%. The survey shows that 3% of children under the age of 5 had their births registered but do not have birth certificates. It also suggests that 2 out of every 3 mothers and caregivers of children aged below 5 years whose births were not registered do not know how to register births. Commending the outcome of the report, the chairman of the National Population Commission, Honorable Issa Kwara, said it is not yet uhuru as the Commission, in collaboration with the United Nations Children Fund, are working on measures to attain 100% coverage of birth registration across the country.
We are actually working on increasing the coverage of the birth and death registration, and truly we have invested more in that area, and with our partner, the UNICEF, as well as UNECA now that came in, and the KOICA, the South Korean agency, we are pushing not just increase in the coverage of birth registration, but also digitizing the whole process to make it faster.
Despite the spike in birth registration, states like Sokoto and Jigawa are seriously lagging behind. This, Kwara said, is being tackled as the Commission is at the verge of decentralizing birth registration processes to ensure more Nigerian children, especially in areas with low birth registration outcomes, are captured.
States that are backward, we pay more attention to them so that they also come up and attain this same level of progress as other states. We want to work on achieving 100% coverage.
Meanwhile, the United Nations Children's Fund indicated plans to support full automation of birth registration in Nigeria. According to the representative of World Body, Chief Child Protection in Nigeria, Sharon Oladiji, the move is to enable the government to attain full coverage of the exercise in Nigeria.
Civil registration and vital statistics are multi-sectoral and multidisciplinary in nature and needs to be strengthened through a holistic and integrated approach.
She further harped on the required political will to drive the birth registration program by respective government.
If we don't have this senior, strong government commitment and leadership, we will not succeed.
Expectations, however, indicate that states like Sokoto and others lagging behind should embark on more advocacy on the gains of birth registration in their localities. Only then will the people embrace and own the policy. CNN News.